My name's Warren. I'm a final year medical student. I'm working with Dr. Perfetto today. Is it okay if we do a cardiac exam?
Yep, sounds good.
Okay, so to begin, may I ask for the vitals, please? To begin with general inspection, we are assessing the patient's general habitus, as well as their approximate respiratory rate, any color changes on the skin that we can see, any grunting or wheezing that we may hear, any kind of intercostal retractions, nasal flaring, sweating, and noting the patient's body position. So I see no tripoding in this situation. Moving on to inspection of the face, we're looking to see if we can see any xanthomata, and I can ask the patient to pull their bottom eyelid down as well, looking for any kind of conjunctival pallor in this case. Can you open your mouth for me, please? And can you raise your tongue? Here I'm looking for signs of central cyanosis, which would appear as blue. I don't see any here today. So next I'll be inspecting the patient's hands. I'm looking for any signs of splinter hemorrhages, as well as any Janeway lesions or Osler nodes. I'm trying to assess if there's any peripheral cyanosis, as well as clubbing of the fingers. So to assess clubbing, I'm going to ask the patient to place his distal phalanges together, looking for Skamroth's window. I can also assess capillary refill by squeezing the fingernail and assessing how long it takes for the finger to reperfuse. A normal response should be less than 2 seconds. Next, I'll begin to inspect the patient's abdomen. I'm looking for signs of coagulopathy, such as petechiae, purpura, or ecchymoses. I'm also assessing for any pulsatile masses, ascites, or surgical scars. I can now assess the patient's JVP. To begin, I'll be placing the patient in a 30 to 45 degree incline on the bed. To assess the JVP, it's helpful to landmark. First, we want to identify the sternal notch, the sternal angle, as well as the two heads of the sternocleidomastoid. To help visualize that, I can ask the patient to turn their head to the left at 45 degrees, and then have them press against my hand with his cheek, raising the two heads of the sternocleidomastoid. Inside, we can identify where the JVP is, roughly here. We can measure it by locating the patient's sternal angle, placing a ruler perpendicular to that, and then having another flat measurement roughly parallel to the ground, measuring the patient's JVP. To assess the hepatojugular reflex, we can push on the patient's right upper quadrant and watch as increased venous return will elevate the JVP. Kusamal's sign is increase in JVP with inspiration. Next, I'll be assessing the patient's pulses. I'll be assessing the radial, brachial, carotid, and femoral pulses. For the purposes of this exam, we will not demonstrate the femoral pulse. To begin, I'll ask the patient's permission if I might palpate his arteries.
Sure.
Thank you. So I'll be palpating the radial pulse, as well as the brachial pulse. Prior to assessing the carotid pulse, I will use my stethoscope to assess for any carotid bruits. For doing this, I will use the bell side of my stethoscope. To assess for any carotid bruits, I will place my stethoscope over the carotid pulse and listen for any low frequencies that I would expect to hear. To make the exam easier, I can also ask the patient to hold his breath. Thank you. For a more thorough exam, I would palpate pulses bilaterally. In the interest of time today, I will not demonstrate that. To begin palpation, I'll first assess for heaves, as well as for thrills, using the pads of my fingers. Moving on to assessing the legs, we can palpate the lower legs and see if there's any indentation within the skin. Grading will depend on how large the indentation becomes. Next, I'll be auscultating the heart. I'll be doing so over the 4 zones that I described earlier, first using the diaphragm of my stethoscope. I'll be assessing for all normal heart sounds that I expect to hear, including an S1 and an S2. I'll also be assessing for any abnormal heart sounds that I do not expect to hear, including murmurs, rubs, gallops, or an S3 and an S4. When auscultating the heart, I can assess for the aortic valve at the right second intercostal border. I can assess the pulmonic valve at the left second intercostal border. I can assess the tricuspid valve at the left fourth and fifth intercostal border. And I can assess the mitral valve at the fifth intercostal border at the anterior axillary line.